Hopefully we're live. Last time it didn't go live. I'm gonna wait till it warms up. But welcome everybody back to the First Inning Radio Show. We're live on the First Inning on YouTube, Twitter. Oh, we are live. Yes. Thank the good Lord we're back. I had some technical difficulties on Friday, but we're back now. Maybe Roger will call, maybe Michael Caputo come back in and join us. But today, but first, hit the like button. It means a lot, and it lets me know that you care. Please hit the like button. Share as well, so I can have some more followers and people talking in the comments. Please talk in the comments so I can see how you feel. But today, but before you do that, and hit the notification bell as well, because that'll let you know my upcoming videos. I usually be at 5 o'clock p.m. Tuesdays and Fridays. And you can search the First Inning Radio Show on any podcast or wherever you listen to whatever. And me, the BX Bomber 2011, you can find me on all social media, Twitter, Instagram, and Facebook. Trying out stereo as well. Check me out on stereo too. But today, I have some news for you. Let me switch over my screen real quick. Take a look what it looks like. Okay, there we go. We have the 2021 season news release of and MLB announces health and safety protocols for the 2021 season. First workouts of 2021 spring training presented by Camping World to be held February 17th. That is this Wednesday, a week from today, actually, from tomorrow. Highlights, I'm going to go through this whole document here, but highlights of this are seventh inning doubleheaders, which I'm going to explain something about that. That means that we're not going to have fans if there's going to be seventh inning doubleheaders. And I'll explain why. Automatic runner and extra innings. That's like, come on, that's like college or Little League. Wearable contact tracing devices. So now we're wearing wearable contact tracing devices. Okay. Now they're going to expand COVID-19 testing. Okay. They're going to have face mask enforcement officers, an active roster of 26, and then 28 in September, which it sounds quite crazy, first of all, that they would even put this out there. But seventh inning doubleheaders. Let me explain one thing. I know MLB is good for doing doubleheaders, right? But they got to a point where they don't do back-to-back doubleheaders. Where if there was, let's say, a doubleheader, the first game will be played at 1 o'clock. Would be an afternoon game. They'll play out that game, and then you'll have the normal game subjected at 7 o'clock to play. Why is that? It's because the day game will be the makeup game. The night game was already scheduled, you see? So they don't do the doubleheader that way, you know? So, and plus they make more money when they have when they kick the fans out and bring the fans back in. They make more money when they do that. So saying that you're gonna have 7 inning doubleheaders means that you're not gonna have fans in the stands, because they're gonna play them back to back. That means that you're trying to get the game's over with as soon as possible. You see what I'm saying? So what I think is they want to run through the games and get it over with. Because if you're a paying customer, why would you see 2 seventh inning doubleheaders? That means you're being robbed of 4 innings. Actually, if you think about it as well, let's say if they did it the way I said it, one game in the afternoon, 1 o'clock start, and the second game at 7 p.m. And they're gonna play 7th inning doubleheaders. They just robbed you of 2 innings of your game. Meanwhile, the people before you, the day before or the next day after, will actually be watching a full game. So you're being robbed of time at a baseball game if you think about it. If you're playing a seventh inning doubleheader, you know what I mean. So I'm gonna read this thing for you really quickly because I have it all set up already. I just gotta click on it. All right. So I'm gonna read this for you, and we're gonna get through it together. We're gonna understand this together. Major League Baseball today announced an agreement with Major League Baseball's Players Association on the enhanced set of health and safety protocols for the 2021 season that adopts current best practices in addition to those in place during the success of 2020 season and reflects the recommendations of the parties consulting medical experts and infectious diseases specialists. Okay, so the enhanced 2021 operations manual will apply during spring training, the championship season, and the postseason, and also includes 1 year commutation of 7 inning double headers. Wow, so we're gonna a continuation continuation, there we go, includes of 1 year. So for this one season, they're proposing they do a seventh inning doubleheader and the modified extra innings rule during the 2020 championship season. Spring training presented by Camping World begins Wednesday, February 17th. That is a week from tomorrow, from this video. Let's see. In quotations, we are able to complete a successful and memorable 2020 season due to the efforts and sacrifices made by our players, club, staff, and MLB employees to protect one another. The 2021 season will require a redoubling of those efforts as we play a full schedule with increased travel on the non-regionalized format, MLB said. So they're not going to regionalize like they did last year where they can only play in their region. They're going to play their normal schedule, as what they're saying. We have built on last year's productive calibration between MLB and Players Association in developing and enhancing safe plan with the consultation of medical experts, infectious disease specialists, and experts from other leagues. We all know the commitment it will take from each of us to keep everyone safe as we get back to playing baseball, and these enhanced protocols would help us do it together. So here's the highlights of the 2021 health and do that over. The highlights of the 2021 health and safety protocols. Say that 10 times. Which are fully documented by comprehensive operations manuals and have been distributed to 30 MLB clubs, includes health and safety procedures. Okay, we're gonna read that. This is what they're gonna have to do. This is gonna be the law against COVID. Bottom line in baseball. So let's understand what's happening here. A joint COVID-19 Health and Safety Committee composed of one MLB and MLB Player Association representative and 2 physicians will continue to manage day-by-day oversight of the monitoring and the testing along with other aspects of the health and safety protocols. Now, each club must submit a written COVID-19 action plan, okay? A consultation with its medical staff and government health authorities to approve by the joint committee. Each club will appoint an infection controls operations manual. So, yeah, it's gonna, man, we gotta figure out what Cuomo's gonna let us do. Or subject to discipline or failure to monitor and enforce compliance. Now, the Bronx right now is at a rate of 8% right now. It's the highest rate of all of New York City. And Yankee Stadium is smack dab in the middle of that high infectious rate. So do you really want to go to a game? Intake screening, which may begin up to 3 days prior to a player's voluntary report date, will include a mandatory 5-day at-home quarantine prior to reporting to spring training, with the exception of performing essential activities for the or for approved individual outdoor exercise and workouts, followed by diagnostic PCR and antibody serology testing. Individuals must self-quarantine and may not access club facilities until their intake screening results are reported. So that means they got to get all these tests before they even arrive to the complex of spring training, meaning Steinbrenner Field, right? So frequent PCR testing will be administered by the Sports Medicine Research and Testing Laboratory on saliva samples collected via the Spectrum Solutions sDNA 100 saliva collections kit. Players and others on-field personnel will continue to be tested at least every other day throughout spring training, the 2021 championship season, as an applicable the postseason. Daily symptom screenings and temperature checks will be recorded at least twice daily as a supplement to routine monitoring testing. Accurate and reliable point of care testing will also be available to the clubs at home and on the road. Now they're doing by saliva. Everybody else in the world is doing it by the nose. So how perfect? What's the difference, right? I guess it's easier to put it in the mouth. Is less thing, but it's now they just put it right around the nose. They don't even go all the way that deep in there. So it's really not a big deal. It more tickles than hurts. Like you want to sneeze. So let's get into the next one. Individuals who test positive will be required to isolate for a minimum of 10 days. If you test positive, receive appropriate care and monitoring from the club medical staff and be cleared by the joint committee and individual's team physician following a mandatory cardiac evaluation and a determination that the individual no longer presents a risk of infection to others. Wow, that was a lot. We are expanding across to voluntary COVID testing for family and household members of covered individuals and are planning to utilize improved joint of care testing options to supplement the regular saliva-based PCR testing from last season. Additionally, MLB will continue to offer capable testing for healthcare workers, first responders, youth organizations, and other members of MLB communities as a public service. All right, so they're going to do testing. They're going to test the employees. Mental health and well-being resources will be provided to players and club staff by clubs and the parties throughout spring training and the 2021 championship season. So they're going to have some resources, meaning money, to do this stuff, to have it set up in a way. Okay? So mental health and well-being resources will be provided to... I'm sorry, I just read that. We added a new league-wide code of conduct prohibiting certain high-risk activities outside the ballpark. Now, for one, let's read the rules. Okay? Now, these are the at-risk, high-risk activities outside the ballpark that are prohibited. For spring training, championship season, and postseason, covered individuals may not attend indoor gatherings of 10 or more people, indoor restaurants, bar and lounges, fitness and wellness centers, entertainment venues, gaming venues, and etc. Casinos. Of course, you can't be in a casino because you can't gamble on baseball. You're a player. And any other activities that are prohibited by the state or government, local governments. Okay, we got that. Now let's get into number 2. Now for spring training, covered individuals and any members of their household must quarantine at home, with the exception of club directed baseball activities at club facilities. Travel with the team individually, outdoor physically activity Outdoor dining, okay, approved by joint committee, and perform essential activities like medical care, blah 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 blah. Now for the championship season, I don't even understand. For the championship season, whose championship season? I guess for the championship part of the postseason, let's say. Covered individuals during road trips are not permitted to leave the hotel other than team activities at the team facility or ballpark, and or other than medical reasons, outdoor walks, exercise, outdoor dining, if approved by the joint committee, or for low risk outdoor activities, or in extraordinary circumstances, members of traveling party must notify a club compliance officer before leaving the hotel. Now, covered individuals may not meet with anyone not part of the traveling party, whether at the team hotel or individual hotel room or otherwise. Other than being permitted to meet household or family members outdoors, covered individuals may not congregate in areas of the hotel or enter the hotel room of other member of the traveling party for any reason unless approved by advance by the club's compliance officer. Now, any covered individuals who are found who have violated the code of conduct are subject to potential discipline, including suspension or future of salary man of salary days spent away from the club while mandatory self-isolation and quarantine results from the violation. Man, so we made significant changes to the contact tracing process to reflect changes in guidance from the CDC and medical experts, as well as our experience and the experience of other leagues over the past year. Okay, so this is what they're implementing in this year. Okay, we're gonna get into what they're implementing this year. Right? Let's see what happens here. Okay, contact tracing devices must be worn at all times while in club facilities, during club directed travel, and while engaging in team activities, including drop group workouts and practices. All right, so you got to wear a contact tracer. Each club must designate a contact tracing officer responsible for overseeing the club's contact tracing process. So you have to have a guy making sure that it's all working. Good job. Now, each club must designate a contact tracing working group, including a medical professional with experience in infectious disease responsible for identifying and reporting close contacts. So they have to have a medical staff with that guy that makes sure that contact tracing works, right? So it's an entourage. Now, a covered individual who has been identified as having been in close contact with a confirmed case of COVID would be subject to mandatory quarantine of 7 days and must test negative on day 5 or later, among other requirements to rejoin the facilities. Additional monitoring precautions of an individual are not designated as close contact will be required. Now, face coverings must be priority worn at all times when in club facilities and in the dugout, other than for players on the field during the game or during pre-game warm-ups. Each club will appoint at least one face mask. There you go. So enforcement officers and atomic fines will be issued for non-compliant during games, with fines collected donated to charity. Okay, so we're getting somewhere. So let's see what else they got. There will be no pre-game exchange of the lineup cards. Man, instead each club will input their lineup club into a mobile application provided by MLB. All right, so they're gonna text it. MLB and the Player Association will revisit the health and safety protocols throughout the season to consider whether enhancements or relaxations of certain protocols are appropriate based on experience or changes in circumstances. Now, here are the rules for playing on the field. And this will be the last little hurrah that we got here, and we're going. Okay? Now, on the field, playing rules. I want to say it like Bob Shepard. Any double headers scheduled in connection with the 2021 championship season will consider of 2 7-inning games. The modified extra inning rules employed during the 2020 season. Each extra half inning will begin with a runner on second base. Will also be in effect for the upcoming season. Notwithstanding anything to the contrary in OBR whatever, any player may appear as a pitcher at any point during the game. No extra inning requirements or 6-run rule. However, all players eligible to participate in the game, regardless of position, must be included on that game's lineup card. Now, prohibitions against unsportsmanlike conduct will be strictly enforced to prevent unnecessary physical contact and support physical distancing between individuals on the playing field. In this respect, players and managers should maintain physical distancing from all umpires and opposing players on the playing field whenever possible. Players and managers who leave their positions to argue with umpires come within 6 feet of an umpire or opposing player or manager of the argument, or engage in altercations on the field are subject to immediate ejection and discipline, including fines and suspensions. That's my Bob Shepard thing. So here we go. Rosters, and this is the last of the rosters, and this is the last of it. The active roster limit will revert to 26, expanding to 28 in September, but the limit on the number of pitchers on the active roster at any given time has been waived for the season. So you can have more pitchers? I don't get it. Okay, so we have also agreed to allow any club that experience a COVID-19 outbreak among their players to add to the Major League active list temporarily, without the need for those players to be placed on waivers, outrightened, or option in order to remove from the 40-man roster with players returned from COVID-19 related injury list. Oof. Sorry. Now, a club is permitted to carry up to 5 additional taxi squad players on all road trips with the major league team. If the club elects to carry 5 additional players, at least one must be a player with designated position prior to the season as catcher. Players on the taxi squad are permitted to work out with the major league club, but not permitted to be in uniform and in the dugout during games. Upon the conclusion of each road trip, players on the taxi squad will return to the alternate training site. Wow. So that means once he gets healed back, you gotta go back to the rail riders up there and see back to the AAA. So there you have it. MLB announces its health and safety protocols for the 2021 season. And I don't know. I don't really like what's going. Well, yeah, they have to take their precautions and stuff like that. But I don't really like the way it sounds because it sounds like with all those precautions going on, it sounds like they don't even want to have fans in the stands at anyway. So you might as well just play the season without them because they're making it sound so severe with it because I don't know, that's every day of people. You're playing 7 days, 10 days a week of people every day. It's not like a football game where it's one game every Sunday and you can test people for that game and they'll go to the game COVID free. Perfect example is that was the Buffalo Bills game. They had like over 7,000 people at the game and there has not been a an outbreak or anybody getting sick from that game. So it does work at one point or another, you know. But it is up to they say it's up to the local governments for it to actually happen. And by saying that, you know, by saying that, we gotta wait for De Blasio to uh to even let us in because right now the Bronx is at a all-time high, and it's at what 8%, I believe, and Yankee Stadium is right in the middle of that, so it's not really a good idea to even in my opinion, even set it up because you got to remember, so many people are going to travel to the game. And if you're the less fortunate to travel to the game and you have to ride the train as the less fortunate, at least two people on that train that you ride with got COVID. And a lot of people don't wear masks and stuff like that. So people are going to get sick. You can open yourself up to being compromised and sick behind this. So you really have to be careful. I've been lucky. I got a motorcycle, so I can ride to work and I don't gotta be on the train. But if you saw my last video of Yankee Stadium being a vaccination site, you see how I show you how it is to be on a train. And they don't even have the air on the train. They don't even have the air circulating on the train. Shit is off. Okay, so you gotta smell the guy next to you, and his coat smells like the closet, horrible, so you don't want to be smelling that type of stuff. So, should the players play without fans? Yes, they should play, but with fans, no. I think that's real selfish, to even think of even going to a baseball game. You gotta think that it's selfish to do it because you're really compromising bringing the spike back up. And not only that, we got more strands on the way. And they're here already. The African strand, UK strand, Brazilian strand, this strand, that strand, I don't know strands. They're all here. And what they're saying is that the vaccine is not even protective against these other strands. Okay? So I'd rather you wait. I'd rather you wait to get a vaccine shot when they perfect it. Now, a lot of them other diseases, it takes them 20 years to create to even create a vaccine shot. No one produce it. It takes like another 25 years or something like that for all these diseases that we got that we don't have now. No more. Like nobody has the chicken pox no more. Nobody gets the measles no more. Stuff like that. Nobody gets smallpox and stuff, or whatever. Nobody gets that stuff no more. None of these kids get the chicken pox and stay home. Nobody gets that, because they get vaccinated for it. So, yeah, that's gonna be the ending of the show here. I would like to thank everybody for listening. If you listened to this so far, please hit the like button. It'll mean so much to me. And share it with other Yankee fans, or even share it to Yankee pages that may not even know about me, and maybe they should know about me. So send me there, and hopefully I can get more people. Let me know what you think. Comment below, and follow me at BXBomber2011 on all social media. That's on and Instagram and Facebook and YouTube. So so long everybody, and see you on the next one. See ya.